is in motion. It's Tuesday, July the 12th. I'm Clint Lambert. I am the host today, and I am very pleased to have with us this morning two representatives from our medical center. In fact, one of them is my own private practitioner that I see, my primary, and in the form of Dr. Sonia Bethel, and she's the director of the medical center, and she's going to tell us some things that's going on there. And you've got a guest with you this morning also. And it's Pat Ferrari, who is our psychiatric clinical nurse specialist. And she's going to talk to us some about all the great work she's been doing here for the last 16 years. Okay. But welcome. Glad to have both of you with us.
Thank you. Yeah, it's always a pleasure to be here and share thoughts about what's happening in the medical center. I can say that this is a time of great transition for us. We are in a process of rebooting with staff. We do have some staff shortages right now, but I want everyone to be aware that we are actively in the process of recruiting some very capable geriatric physicians and nurse practitioners.
Wonderful.
As always, the task is a little daunting because you want to have a combination of someone who is very caring and nurturing, but also is very knowledgeable and has experience taking care of seniors. And it would really be more of a problem to select the wrong individual, because I think our residents tend to sort of get very accustomed and very, very comfortable and with the person that they're seeing. So it does take some time and some effort on the part of the local HR as well as our corporate office to find just the right personnel. So we ask for your forbearance and your patience as we go through this process.
Do we have any idea when we might maybe seeing somebody?
Well, yes, we are very close to hiring a nurse practitioner.
Right.
So I would suspect that that'll happen within the next couple of weeks, and she's immediately available. So I would say by August 1st, that'd be a very likely.
So that will bring us to having three?
That will bring us to two nurse practitioners.
Two nurse practitioners, okay.
And then we still have to seek for another MD. The MD process is, understandably a little bit more involved.
Right.
And we'll let you know as soon as we know about a prospect that's sort of hovering.
Okay. So that would bring us to 5 as far as
Correct.
MDs.
Exactly.
Are we going to be capped at 5, or is there a possibility? So we will be capped at 5?
We'll be capped at 5.
Okay.
That's correct.
All right. Other things happening? I mean, we've got a new clinical manager, I understand, who's been with us now for
several months. I would
yes.
say 6 months. That's
okay.
Jemima Danke, and she's been doing an outstanding job of trying to hold everything together.
Right.
Whether it involves scheduling for us or resolving issues for residents, as well as keeping our office staff operational, and I think she's been doing a great job with that. We do also have a little bit of a turnover in the office staff, and it's early yet, so I can't say, but we will be hiring an additional medical assistant to assist the medical team in getting the job done of taking care of you.
Very good. And you work very closely with Pat.
Yes, absolutely.
And Pat, welcome. Glad to have you with us. What do you do, actually?
Well, I am the mental health nurse for Green Spring and for Garden Ridge, and I'd like to give you a little bit of my background so people can more or less see how I got to be where I was and where I am.
Where you are.
I started my career in nursing as a pediatric nurse, got fairly involved with a lot of different types of cases, and one thing that always more or less caught my interest was how children reacted to their illnesses, their illness behavior, if you will. So when I came around to thinking about going back to graduate school, I looked into mental health nursing, got a degree and went back into a pediatric setting in a hospital doing what was referred to as psych liaison nursing.
Yes.
Eventually went into inpatient psychiatric nursing and then to home care, and most of home care is senior citizens. So I stayed in that for quite a while, was certified as an adult psychiatric mental health clinical nurse specialist, and that was kind of just a practical route to get to Green Spring, and I've been here for for 16 years.
Very, very good. I certainly can identify with what you went through and remember the test with the psychiatric clinical nurse specialist. I mean, that was the hardest test I've ever had in my life in regards
Yeah,
to
it's challenging.
Yeah.
And as the title implies, it says psychiatric and mental health.
Right.
But I do like to emphasize the mental health piece. You know, psychiatric more or less implies illness.
Yes.
And when you think about mental health, we're looking more at emotional wellness,
Right.
or how people cope with different situations, how they relate to other people, and probably most importantly, how they think about themselves.
Yes.
And sometimes that comes easy. Sometimes we meet a lot of life challenges where it's not that easy.
Right.
You know, certainly there are biological and chemical factors that come into play, but there are also quite a few situational and environmental things that happen. And life happens.
Yes.
You know, we run across illness and injury and different situations where people move or retire or lose support systems or change support systems. So a lot of things more or less interfere with the way we view our environment and view ourselves.
And if someone wanted to see you, what would they do?
Well, I mentioned before the word or the phrase psychiatric liaison.
Mm-hmm.
And more or less what that is when mental health professionals are in a medical setting. And so that probably is the closest way that I would describe what I do. I work as a part of a medical team.
Okay.
So most often a lot of residents come into the medical center. They're seen by their physicians. Different types of emotions or behaviors are picked up, or residents bring them forward. And most of the residents that I see are referred through the docs or the nurse practitioners. When I go over to Garden Ridge, which is generally half of my day, the team over there sometimes picks things up. The social worker or one of the rehab people, the OTs or the PTs, might identify somebody who's having a little trouble making progress with therapy, and so they make the referral. But all that said, it doesn't mean that a resident can't give me a call and give me a little bit of information and set up an appointment on their own.
Okay. So someone could simply call the med center and say, I'd like to talk with Pat in regards
Yeah,
to...
and you know, we'd
Okay.
see what's going on. I may, if they haven't seen their doc for a while, I may suggest that they go do that first, because it might be something else that's medical that's interfering with the way they're moving forward.
And so many medical illnesses masquerade
Absolutely.
as mental health issues.
Absolutely.
Appear to be mental health issues.
Sometimes medications can cause
Right.
some changes.
I mean, I certainly know that with thyroid, the individuals
Right.
having thyroid problems. And you see them and you say, is this, the thyroid issue? Is this a mental health issue
Right.
in regards to it? So,
Right. The physical and emotional are very closely entwined.
yes.
So.
Very good.
That also helps us a lot, with some of the cognitive changes that we experience. Situationally, someone who has transitioned, say, from independent living to an inpatient setting, and then is faced with rehab and, all of the challenges of recuperation, often there is some transient cognitive decline, and that sometimes also brings on behavioral changes. And in those instances, we call upon Pat to often, help sort of smooth out the rough edges,
Right.
so to speak. So,
And with doing that, do you work with the grief and grieving nurse as well, or the practitioner that does the grieving workshops, or?
No, I can refer if I think somebody would benefit from that. And likewise, they can refer to me if they think that the group itself, the resident might need more help after the group.
You mentioned group. Do you do any group therapy?
No, I don't. Not in
Okay.
Green Spring, no.
So it's purely individual, one-on-one.
right.
You have a therapeutic hour?
In the medical center, I do.
Okay.
In Garden Ridge, it's a little more flexible. It's
Okay.
usually briefer.
And are you seeing individuals with short-term or with long-term therapy issues?
Both. Some people will benefit from just brief weekly sessions. Other people then might need a little tune-up every month or every 3 months just to keep them on track and help them stay motivated and
Wonderful.
feel better about themselves and the way they relate to other people.
Okay. What I'm hearing is you work very closely with the docs. And it's really important for residents to to let their docs know what's going on with them, and to say, hey, I'd like to see somebody, or I'm having an issue here that might benefit from seeing someone that I can talk things out with.
Right, because we both may have to work with the patient and keep on track and kind of coordinate strategies. So I think it's important for the residents to understand that those two pieces of their care are going to be collaborative.
If someone moves in, they're on an antidepressant, let's say, who regulates those antidepressants? Do the docs do it? Do
Yes,
you do it?
the docs do.
Okay.
I may make suggestions based on some of the symptoms that I'm seeing. A lot of antidepressants are targeted toward different types of behavior, so my input is important for them to make that choice.
Okay.
Yeah, and often a change, may need to be made. There are folks who may have been on a long-term antidepressant for a period of time, is possibly maxed out at a, recommended dosage, and then, we see them and think, well, perhaps it's time to consider, making a change.
Right.
And often we will initiate the change and then get input from Pat, but it can also be in the reverse order. We could say, I'm thinking maybe, it's time for a change, and, have Pat evaluate them, and then she'll say, yep, I think it is time, or maybe we can push the dose a little further, or, try some alternative therapy. So it is a collaborative effort.
And a lot of medical issues that come up over the course of somebody's life can impact how they respond to an antidepressant too, and so that might create a need for a change as well.
Good.
Absolutely.
Let's say that I moved in today. How soon could I see you after moving in?
Depends on what my schedule looks like. Sometimes that's much easier to regulate than others. Some seasons are a little busier. If I can juggle with Garden Ridge, if more or less my clientele in Garden Ridge is a little on the lower side, I can give more appointments in independent living and vice versa. So there's some flexibility to that.
Okay. But if someone needed to see you, they would be able to probably see you within a week or 2 weeks?
Yeah, I could make that happen most likely.
Okay.
And we as docs usually
weeks.
can also request that an adjustment in schedule is made.
Right.
And Pat's very flexible, and she's generally able to do that within a couple of weeks. Yeah.
Great.
Some of it is triaged, really, that, if the person has something that's been going on for a while and they can wait a little bit, maybe 3 weeks, that's fine. If somebody else has a little bit more of an urgent need, then I'll try to see them a little sooner, so.
And then the obvious question is, you're the mental health nurse. You go on vacation, you get sick, is there anyone that covers for you?
One of the other mental health nurses in one of the other communities can be contacted by phone by our docs if they need to consult with somebody.
Okay. Very good. Very good. Well, you're a valuable resource. I mean, and there's certainly a lot of mental health issues that take place within our community, as they do in all retirement communities. And I hope people give you a call if they need to be seen. Let the docs know if they need to be seen. There's nothing wrong with having someone to talk to. There's nothing wrong with having to work through a mental health issue.
No, we all try the best we can to cope with things, but as I said before, life happens, and sometimes we just get hit with too many things at once, or something that's just overwhelming where things weren't overwhelming before.
Right, exactly. Anything else that you need to tell us about your practice here?
Well,
I am going on vacation next week, so if someone needs to be seen,
So
they
hold off,
might
right?
have to wait an extra week.
And I was just going to mention, we do also have a consulting psychiatrist.
Yes, we
who's here
have a
monthly.
consulting psychiatrist, usually comes about every 5 weeks.
Oh, okay. Very
Yes.
good. Very good.
Okay.
And the docs are always more than happy to see individuals who have difficulties and refer them appropriately
Absolutely. Yep.
in regards to it. Well, thank both of you for coming today. It's
You're
very,
welcome.
very welcoming to have you with us, and to know that there's a safety net out there. And that's the way I look at mental health. It's really a safety net.
That's good.
Good, positive view.
Yes. Okay.
Great.
Again, thank you very much.